guys, so I just wanted to make a little intro video. So I had the opportunity of working with Nurse Jazz on Instagram, Nurse Jam on her Nurse Jazz Talks podcast, and it was an amazing experience. I'm so thankful, I'm so grateful for the experience. That was my very first Instagram live, and I think it went really well. So I'm going to be just inserting that video here after this. I thank you all for watching. I hope you enjoyed. Go subscribe to her YouTube channel as well as her Instagram. I will leave them the name here, and don't forget to subscribe on my channel and thumbs up this video. Leave down below some questions if you like. I might be doing a Q&A soon, so if you have any questions, leave them down below. So thank you for watching as always. Thank you for all the support, and I will see you next time.
Hi, how are you?
Hello. I don't have my glasses on. If I put my glasses on, you can't see anything. Oh, it doesn't reflect. Yeah, it reflects.
I'm trying to not be so nervous.
It'll be fine. Thank you for inviting me.
Anytime. Did you agree? Did you find the questions okay that I sent you beforehand? They're good? All right. Let's see. What time is this? 9 on the dot. So I'm just going to share it to a few people.
Mm-hmm.
Let's see.
Hold on. Turn this up.
All right. We're about to start. I sent it to everyone that I can think of at least. All right. So thank you for coming.
No problem.
It's a new venture for me, so it's going to take a little time for me to get a little comfortable with the whole live experience.
It's fine.
So to start off, let's start off with you introducing yourself with your name, your title, and your specialty.
Okay. So hi everyone. My name is Kathiana, otherwise known as Nurse Kathiana. I am a cardiac tele-nurse at the hospital.
Okay. So going into Nurse Jazz Talks, last week I talked about why I decided to start Nurse Jazz Talks. I gave a little history about my life and what made me decide to start Nurse Jazz Talks. Mm-hmm. So the questions, I'm going to start off with asking you questions as it pertains to like self-care, mental awareness, and etc. Mm-hmm. And then we'll end off, because it is Nurse Jazz Talks, we're going to end off with a scenario-based questions, how NCLEX based, basically.
No problem.
It's a scenario that I have seen in the actual workplace. I've actually seen it, and I would want to know what would you have done in that particular situation. I don't think I shared the scenario with you yet.
That's fine. You didn't. So it's going to be a surprise.
It is going to be a surprise scenario. So to start off, in the career that we're in, what is your definition of self-care?
So I feel like in my career, self-care is just being selfish, taking that time away from everyone, away from everything, and just doing what you want to do, what you love to do, and just relaxing and taking care of yourself and just shutting out the outside world, in my opinion. So, yeah.
I 100% agree with that. So what does a typical day at work look like for you as a cardiac nurse?
So, as a cardiac nurse, at my hospital, guys, we have 8 patients. We won't talk about that tonight. But it's busy. So, when you get in, I get in typically about 20 minutes early. I'll get my stuff ready, get my Dynamap, get my wow, and, set myself up for the day, get my report sheets ready. And I hit the floor running after that. After I clock in at 6:53, I'm running. I'm gone. I'm starting. I'm getting report. And after I get report, checking on my patients, making sure everyone's okay. And from then, it's just the night just literally flies by.
Really?
Taking care of patients, getting snacks, taking vitals, because we have to do our own vitals at my hospital. Well, first set of vitals. So the first set of vitals, we have to do our own. So I do my vitals, and while I'm doing those vitals, that's when they decide to ask for everything under the sun. So you're running 10 times to get water, 10 times to get some snacks, everything. So it's just very busy. A lot of cardiac monitors, a lot of EKGs, a lot of drips, heparin, amiodarone, cardizem, everything. It's just a pretty busy day. It's really action-packed. A lot going on at my hospital always.
What shift do you work?
I work night shift. So typically I can start with 5 patients. Lately census has been low, so I've been starting around 5 patients. And we can get up to 8 patients. So that's 3 admissions that you can get. So you got to work fast.
Yes, sounds like a lot. It sounds like a hectic thing.
It is. It's real hectic. It's real crazy, but I love it. I love the crazy kind of sometimes.
So, in the event that you had a stressful day, what are some ways that you may alleviate your stress after your shift?
So after I have a stressful day, first off, I love music. So the first thing I'm doing, I'm going in my car and I'm blasting my music. Mostly some gospel music, most likely, praise and worship music, anything that makes me, even some African music sometimes, because, you got to get into the mood. And so I'll have my music blasting. I go get my breakfast. And as I'm driving home, I'm reflecting. So I'm going to be reflecting on my day. What could I have done differently? Where did my day turn bad? What could I have done differently just to make it next time in that case, in that situation? So yeah, I feel like there's not a lot of stuff I can do at that point, only because we're so tired at night. What shift do you work?
I've worked all the shifts.
Okay.
If they call me in right now and say, hey, can you work a night shift? I'm going to say yes. If they say, hey, can you work a day shift? I'm going to say yes. I don't even settle at this point. I can't even say specific shift. I'm just like, my sleeping pattern is all over.
So yeah, me, I have to eat. Eating helps me. I'm a foodie. So I'm going to be eating on my way home, getting rid of my stress. That if I don't work that night, I'm gonna have a drink. Give me something to drink.
I'll be at the nursing station like this. Like I would look up. We have cameras right behind us, and we're not supposed to eat at the nursing station. I'll go right down to to the vending machine. I'll come back up. I'll look at the camera and just go. They don't tell me nothing. Let me eat this food real quick.
See, they don't enforce it at my hospital. Thank God, because everyone eats at the nursing station. They had Halloween candy yesterday. Everyone was eating it. Everyone.
Sometimes you get hungry. Like I think sometimes I'm just like starving on my shift. And I'll have like a quick snack. I'll just walk right into the medication room behind my nursing station. I'll just go I'll stuff my face and I'll put my mask back on. I'll walk back out. The whole time I'm chewing, someone's talking to me. I'm like,
Yeah, that's the benefit of the mask.
Sure.
Yeah, definitely. So self-care, I feel like on my way home. I feel like also, too, when I get home, after you shower and you can think about the day, I feel like me just lying down, silent, no phone, quiet, I think that's self-care as well.
Amazing. So here's my next question for you. So how do you make time for your personal life? Example, I know you're a professional blogger and your work schedule. How do you make time for the both? Them.
Guys, I've been kind of sucking at this. So let me give you a little background. So I'm a first year RN night shift, but I was an LPN prior for 3 years. And so I worked 8-hour shift. I usually worked the 3 to 11. And so me transitioning to that 7 p.m. to 7 a.m., I'm struggling. And so up until recently, I felt like I was failing because like I hit the floor running. When I say I'm someone that like I thrive on money. No offense, like not thrive on money. Let me say I'm a hustler. I've always been a hustler. My family's hustlers. We're Haitian. You know how it is.
Yes, definitely.
And so once I started off my residency, I started doing 4 days a week. Yes, I see someone put their hand up and said they're a hustler too. Yes. And so I started working 4 days a week. And I worked 4 days a week up until last month. And so up until last month, I would, make time here and there for my YouTube or as well as other things. I'll just fit it around work. But I learned the hard way. You cannot do that. You need to make yourself a priority, make your life, the things that you find important in your life, you need to make those a priority. So, for example, me and my YouTube channel, last month I started taking it seriously. I had a goal, 1,000 subscribers. I hit that goal and I was consistent. And I was only probably consistent maybe for 2 weeks straight. I put a video up every day, Monday through Friday. And you reap the benefits of that. You get to see those. So I feel like me in my self-care, I was slacking. But now that I know how to prioritize the things that I love in my life, I feel like I'm able to do it more efficiently.
Okay. Makes sense. I'm a big slacker myself. Like, I think I started the whole Nurse Jazz Talks page since August, I believe, but I never acted out on it. I was just kind of like, yeah, I want to do it, but I'm just kind of like, life is always pulling me back, or I'll just get more hours at work, and I'm just like, oh, well, let me
the
just
money.
go to this overtime.
It's the money.
I was watching my friend's blog and podcast. That's on Period. And then it was like some intense conversation that day. I think it was like, okay, you need to learn how to start putting you first. You need to follow your goals and you start accomplishing your goals. Yeah. And then after that, that Monday, that motivational Monday, I just like, okay, at the end, I was just like, all right, damn. The only thing that's holding me back from accomplishing my dreams and doing what I really want to do is myself. There's no one on my way but myself.
Literally.
After that show, I was just like, all right, let me get going. Let me try to create a flyer. Let me just set a date out and put it out in the atmosphere.
What's the worst that can happen?
I put a date out for October 20th. I had no idea what I was doing. I was just like, am I ready? Am I ready for this? Like, I had no idea what I was doing. Mm-hmm. Like, even up to, like, last week when my first live, I was just, like, I was nervous. I was trembling. Majority of the feedbacks that I got back from the video was like, we can tell you were nervous last week. I was just like, I know. I wasn't prepared for this. I was terrified. But you know what? Even though I was terrified, I kept on pushing. I pushed through the whole live. It was amazing. It was a great feeling after to go back and watch the video after and like, man, I did that. Like, I was able to actually speak out on my experience. And everyone knows I'm a real private person. Something could bother me, I will not speak out on it.
I love that.
For me to take the step to say, okay, let me create a YouTube channel. Let me start going live. I feel like that was a big deal for me. That was a big deal. I'm terrified.
I respect that.
Public speaking. So.
I feel like a lot of times, especially nurses, we're taking care of everyone else. And we lack taking care of ourselves. So at the end of the day, it's like we're breaking our back, going to work, trying to get this money, taking care of these people, especially now with COVID and everything. And it's like, okay, what about us? What are we setting ourselves up for the long term? Because we can't do nursing forever. We're going to get old.
Listen, I want to go up. Bedside nursing is cool right now, but
it's cute.
Like every day on the floor, I'm like, okay, I have to go back to school. I'm like, I'm going back to school. Every day on the floor, I'm like, okay, I'm going back to school. Because I'm like, I love the experience that I'm gaining as a bedside nurse. And don't get me wrong, I want to be able to see everything. I want to be able to say, okay, I have the experience, I have the background. I don't want to just say I'm going to become a NP or DNP without the experience. Like at my facility, I see NPs and DNPs, and then they're just sitting there asking me questions, and I'm just looking at them like this.
Why are you in my face?
I'm just like, Aren't you like, why are you asking me? Like, did you like? I know a few. Not to like, say it's anything wrong with going from your BSN straight to NP, but I would highly suggest like you get that experience. You do bedside. You know how to talk to patients. You have that communication skills, because sometimes you should see how they communicate with the patients. Just kind of like, so what are you doing? Wow.
So you're talking about maybe the NPs who have no nursing background. So they don't know how to communicate. They don't know our struggle. They don't know.
No. Yeah. It's just kind of like, oh, just give a patient this, give the patient that. And
it doesn't work like that.
And I'm just like, have you seen the patient? Like, did you, come on, let's go see the patient together. Yeah. Because maybe if we go see the patient together, you're not going to tell me to just give the patient X, Y, and Z.
I agree with you. 1,000%. Even doctors.
But we're not, that's a whole topic for a whole other thing. I've had a patient that's like destatting right in front of me. I'm sitting here and I'm like, okay, doc, I have a systolic, but I don't have a diastolic. Like the electronic blood pressure is not reading. So you have to do a manual on the patient. Mm-hmm. I'm like, okay, but I have a systolic, but there's no diastolic. Mm-hmm. Like I must have did the blood pressure over like 3 or 4 times to make sure I'm not tripping. Mm-hmm. I'm like, no, the patient has a systolic of like 80 something, but systolic is too low. Not audible, nothing.
It's not going to read.
The doctor comes, and I'm thinking, okay, he's going to try himself to, see, okay, maybe,
check out the patient.
I'm tripping. He just comes. He doesn't even touch the patients. He just stands over the patient, just looks at her like this, and just tells me, oh, do the blood pressure again, and he just watches me. And he just goes, oh, okay, well, she's DNR, she's DNI, so.
We won't talk about that. We won't talk about that.
I'm just like, okay. I'm just like way above my pay grade. I have no, I can't even be mad right now. Way above my pay grade. Yeah. So there's that.
Yeah. So we definitely do have to take care of ourselves though, as a nurse, especially the way these doctors talk to us. You have to take care of yourself. What are some ways that
I haven't experienced a doctor that has spoken to me incorrectly so far. It's all like, doc, hey, doc, how are you, doc? I can't say I experienced a doctor speaking down to me as of yet. Mm-hmm. But a typical day for me, if I come home from a stressful shift, I would come home and let me tell you, I'll just stand in the shower. I'll just like a nice hot shower.
Let the water
I'll just stand there like.
It's nice. It's nice.
Or even before a hot shower, I'll just go to Burlington. I'll just walk
and do what?
And go aisle in Burlington. I don't even know what I'm looking for. I come out of Burlington with things I don't even need. I'm just like, yeah, let me just do some stress shopping. I'm just walking like, oh, this would look cute for the house. Oh, this would look cute for the house. But that's my way of like, after a long day, like my feet is throbbing, but I'm just like, okay.
Some people are asking some questions.
All right, let's see if I can read the question. One of the questions says, were you afraid of contracting COVID when the pandemic first began? How did you deal with that, and what are some precautions you took while on the job?
No, I mean, at first I was, but then I got into the mindset, honestly, at the end of the day, everyone's going to get it. I haven't got it yet, thank you God, but being a nurse and being in patient space, you don't know who has it, you don't know who has it. They're giving you these little masks. Some of them are cheap, some of them are good. It's hard. So, what was I saying? Was I afraid? Yes, but now, no. Are you afraid of catching COVID?
You should see me walking in the hallway. I wish you could see me walking in the hallway. I just throw a mask on. Like, they'll say, oh, gown up, and I'm just like,
yeah, it's a lot.
It's a lot. I'll just be like, they're just like, oh, you're touching the patient like that? And I'm just like,
wash your hands. Don't touch your nose. Don't touch your mouth.
Wash my hands. I'm going to do all of that at the end of the day. I'm not going to, like, listen, if something happens to a patient and I need to go, you think I'm going to take time outside the patient's room to be trying to gown up? The most that I'm going to grab a glove real fast and put gloves on my hand. But if I have to get to a patient, I'm not going to sit there and be standing to try to put a gown on. No, I'm going to rush into my room. I'm going to do what I have to do. We'll figure the rest of it out. Like, okay, God forbid, I catch COVID, God forbid.
Yeah.
It's like, okay, well, I did my best with that patient. But at least if I know comfortably that I got to the patient in time.
Yeah.
So what?
I feel like your mind would be settled. Yeah. I agree with you.
It is part of the job.
Yeah, it is.
So, here's a scenario for you. All of my scenarios, like I said earlier, is going to be based off things that I've seen in life that I find to be crazy.
Okay.
It's a lot. So, you walk in on your shift. The nurse that you're relieving is like adamant about she has to go, she has to go, she has to go. You're relieving your patient. You're relieving her from her shift. Oh, all your patients are stable, etc. Oh, I gotta go. I'm like, hold on, finish counting your narcotics. I'll be right back. Let me do my rounds. As you're doing your rounds, you find a patient who is lethargic. The patient has a heart rate of 49 and an oxygen saturation of, I want to say, 60-something %, 70%, fluctuating. What do you do as a nurse?
I feel like that's a trick question. It's a trick question only because I feel like report is not done. Until I say, okay, you can leave now, report is not done. But at the same time, that patient's critical now. So I feel like I'm going to see if they have oxygen, try to get that patient stable ASAP. But at the end of the day, it's kind of not my patient as well. You know what I mean? But you're going to help. Ooh, that's a tough question.
I don't want to go into too much detail on how I found the patient. I think that how I found the patient. Yeah. Is a little bit more of like the...
So are you saying that the nurse that gave you the report is gone already?
No, she was ready to go.
Yeah.
But you're just like, hold
on, come back and just send to this patient. Yeah.
Well, she was in the middle of
that's what I would do. I would be like, no, Gina. I don't know who Gina is. Gina, you're not done. This patient is critical. Come help me. I'll help you, but this is not my patient. Like, you know what I mean? You're not done. You're not leaving yet.
What did you end up doing?
Huh?
So I ended up, she was in the middle of counting her narcotics. I said, because I didn't know her nurse. I said, nurse, you, come here. I don't know your name. Yeah. I took her hand. I said, let's go. Yeah. I paid the exact same way that I found the patient. I didn't touch not a thing.
Yeah.
I didn't touch not a thing. I was just like, let me go. I'm like, are you aware that the patient was still like this? Like, your aides left at 7 a.m. They didn't even wait for someone to relieve them. They was just gone. They were just like, oh, the aides left them as... I'm just like, the aides did... Excuse me?
Yeah.
I'm like, that's your patient. I just came in on the shift.
Yeah.
She was like, oh, he wasn't like that. He probably got up himself. And
so this patient was probably on the floor or something?
Possibly. I'd rather he had been on the floor. Forgive me, on the floor than the way that I found him. And it's just kind of like, she was like, oh, well, he probably ended up bringing himself to that position. I'm just like,
no, I'm not touching nothing.
I'm like, no, you're a new nurse here.
That's
so
let me make the patient's in the bed and like, just chilling.
You're a new nurse here, so let me make myself more clear. I'm familiar with the floor. I'm familiar with all of the patients on the floor. It's a long-term facility. It's a rehab facility. You see the patients every day. I know the patient. I've worked with him for the past, 4 or 5 months?
Yeah.
He does
something not right. Something's going on. You need to go ahead and call 911 and go ahead and transport your patient.
Well, if he's DNR and DNH, there's nothing much that we can do.
Oh, the patient was a DNR. Okay.
You can't even hospitalize him. Do not resuscitate, do not intubate, do not hospitalize. So it's just like comfort measures only. So at that point, the only thing
they need to call the doctor to figure out what comfort measures the doctor wants to do, or call hospice, figure out what hospice wants to do. But that's not on us. That's not on us.
The first thing that I did was I said, okay, let's start off on 2 liters of oxygen and monitor it with the pulse ox on his finger. It's not going up. Let's up it a little more, a little 3. Okay, it's looking as 50s, like right now.
The patient is DNR, correct?
Yeah, DNR. Heart rate.
Call hospice and have crisis care come as soon as possible. What can you do? You know, as sad as it is, some of those situations, it is what it is. Like, you can't really do much, you know, which is sad. Ooh, I don't know. That nurse wouldn't have liked me, though, if I would have found that patient like that. Definitely.
I'm big on, as I'm doing my rounds, when I walk into my shift, I'll accidentally, like, okay, some patients, like, you just look at them and you could, like, some of them snore, you can just look at them, you can tell they're breathing. But if you're just laying there, like, I can't tell if you're alive or not. I'm going to accidentally bump into the bed, like, oops, my bad.
And wake them up.
I'm just like, oops, my bad. And then if the bed, if you move when I bump the bed, I'm just like,
you're alive.
You're alive. Next patient. So in my facility, we have 42 patients on the floor.
Yeah. I've been there.
It is the
It's a lot.
hectic thing that I've ever experienced. But you know what? It's like, in the beginning, it was like, what the hell? I have 42 patients on the floor.
What the hell are you doing
like,
at that
time? You're just like, all right, you know your patients. Like, I have worked all the 5 floors. So I know every single patient. I know all of my patients throughout the 5 floors. So it's just like, all right, it gets better with time. You know, okay, for these patients, you have to do their blood pressure. For these patients, it's just like, yes, girl, or I'm innocent. 42 patients. We have 42 patients on the floor.
That's sniff life for you. Rehab.
Rehab, long-term facility.
Rehab nursing, long-term. It's different.
It is.
Don't knock it till you try it, though.
It is tough, but the experience that you gain, that's one thing I would be grateful for. It
made me the nurse I am today, no doubt, 1,000%.
The experience that I gain is amazing. It is amazing. It is hectic. You'll be dealing with this amount of patients, and then you have a new admission, and I'm just like, and then they're just walking in, and the ambulance is just walking with a new admission, like, oh, you have a new admission. I'm just standing at my cart like this. So I guess I'm not going home tonight on time.
Why am I making myself through this? Home health nurses are home chilling with one patient, sitting down comfortably, and we're on our feet the whole entire 8 to 12 hours.
I'm just like, all right, so I guess, like, I could work 16 hours straight on my feet. I could work 16 hours straight without a sip of water. And like, I'll put the water on my cart to take a sip of water as I work, and it's just like, it'll start off as a smooth shift, and then from there it's just like, you don't know what the hell happened. It's just like, it's a roller coaster.
I miss it though. I love it. I love rehab nursing. I love rehab nursing. Did it for 3 years. I love it.
I would definitely say, if you want the experience, gain the experience, bedside nursing, start off rehab nursing, long-term facilities, because you're going to see a variety of things. You're going to see colostomy changes. Not one of my things that I would like to see, or that I would.
Wound care. You know how many nurses are so scared of wound care at my job, and I'm just like, okay, give me the stuff. I'll do it for you. I don't care.
Yeah, wound care. As soon as they, I'll be half asleep and they'll call me because they need a nurse to cover. And the first thing I say is, what do you need?
Yeah.
Oh, can you do treatments or wounds? I'm like, no. They'll be like, okay. Can you come in? And then we'll pull another nurse off on a floor to do it. I'm just like, now we're talking. I'll be right there. Yeah. So wounds is like, I'm not.
Not everyone has the heart.
I do not.
I don't know. I got lucky, I guess.
I do not have the heart right now. Like, it's crazy because when I was in nursing school and I was in clinicals, I saw the craziest wound ever. And I was just like, my professor was all like, you have to maintain a straight face. You have to maintain a poker face. You cannot gag. You cannot do nothing. You cannot pass out. The whole time he was just kind of like, Jasmine, you good? You're not going to pass out? Like, Jasmine, you good? I'm just like, no, I'm good. And the whole time, like, to be able to see a physician or someone able to put a whole fist through a wound, it's just kind of like, just like, every time I see someone put a fist through a whole wound, my head would tilt to the side, like, what the hell? Like, you could put a whole fist through a wound? Like, that's insane to me.
For me, the wound care is not so much the wounds, dressing them, It's the seeing it close, seeing it heal. The whole process is so beautiful. So beautiful. A wound go from this to this? Beefy red? You're crazy.
Someone asks, does working as an LPN adequately prepare you to work as an RN? Do you think such an experience is helpful? I've seen, I follow a variety of nurses. I follow a variety of nurses, blogs, etc. And a few people have asked this question, and some of the nurses have said, "Oh no, do your BSN and just get it over with." Personally speaking, from the standpoint that I am, when I first started school, I was big on, oh, I want to do my BSN. I want to do my BSN. My mother was like, do your LPN, do this, or do your associate of an RN, and then work your way up.
Oh.
And I was just kind of like, no. But let me be honest. There is things that an LPN or an associate RN can do that a BSN may not be able to do. Reality is, you're doing the same thing. No matter what title you have, you're doing the same thing. In reality, some facilities, the LPN is getting the same thing as an RN and has way more experience.
It depends where you live, what you're doing, but yeah, it does happen. It does happen.
Same experience. There's nothing wrong with starting off as an LPN, then going up to RN and going to do your BSN. It's all time, because at the end of the day, you're going to get to the point where you want to get. You're going to, okay, you want to be a BSN nurse. You want to get your graduate degree in nursing. You're going to get there. So what you start off small. LPN is still a nurse. A RN is still a nurse. A BSN is still a nurse. No matter where you are, you're still a nurse. You're still caring for patients. It's the same thing. Same experience. In some cases, the same money. Trust me. Some people say you can't get into a hospital without a BSN degree. Let me tell you off the bat.
They're not.
It's all about who you know.
Business right now, though. Honestly,
especially with COVID, they're not worrying about no BSN. You can work. They're telling you, come, we're hiring you. As long as you can work, they're saying, okay, we're hiring you. Trust me.
I get that question a lot. Oh, should I even just do the LPN? Should I just go for my RN? The first thing I say, do is what's best for you. If you don't have a lot of bills, you're young, you're free, you ain't got no responsibility, go for your RN if you want. If you have kids and, you know, you have more responsibilities, financial life, whatever, or you just want a little experience in nursing to see if you really like it, because some people don't even like it after they get the LPN. Go and do the LPN. Like, do not knock anyone for doing their LPN before doing their RN. Just because it's a year, just because it's a technical degree. At the end of the day, what I used to say is, I'm going to save your life as an LPN. I can put some oxygen on you as an LPN. Do not try me. So yeah, definitely. If you're interested in going for your LPN, go for it, and see where life takes you after that. If you still want to do it, then go for your RN, go for your BSN, go for your NP. Like, don't stop, and don't let people tell you how your journey is supposed to go. I know so many people went for their RN, went back, got their LPN, or went for their to be a doctor and went back and just started at LPN and working their way up. It is what it is at the end of the day, you know? So, yeah.
Someone said, I start my nurse residency program in November and I'm terrified. Do you have any tips for a new grad?
I have a lot of tips on my YouTube channel.
At Nurse Capiana.
At Nurse Capiana. I have a video on that. I have 3 videos on tips for new grads, but short tips. Let me see. You start your residency, you're terrified. Be open. Listen to what the people are saying to you. Ask so many questions. Talk. Network around on your floor. See what things the people like on your floor, what they don't like. Try to get a routine. And you know, you're a new grad. You're gonna mess up. It's fine. Don't make the same mistake twice, though. And that's it.
Treat your CNAs like gold. That's all.
Love your CNAs. Kiss the floor they walk on, because they're doing the harder part. They're your eyes and ears. If you have a good CNA, they're going to peep when your patient is declining before you.
So, for example, when you're working in a facility that has 42 patients, sometimes you go in to see that patient one time for the day, and that might be the only time that you can go see that patient again, because you have to attend to 41 other patients. Yeah. However, the CNA that has, like, where we have to do hourly check rounds on the patients. We do the initial rounds, we do the last rounds, but in between, the CNAs are responsible for doing the rounds in between. Let me tell you, if there's something, they're going to say, nurse, this patient is X, Y, and Z. Let me tell you, you're going to drop everything no matter what you was doing, and you're going to run across the other hallway, and you're going to attend to your patient.
I agree.
My CNAs, I love them. Like, I've seen some new grad, they'll walk in, you know, they'll think that they're all that. Oh, I'm a nurse, I'm a nurse. Listen,
Yep. And they can't do nothing.
You can be
They
a
act like
nurse,
they
you
can't
can't
do
do
anything.
you can't do shit without your CNAs.
Yeah.
So honestly, listen, if my CNA tell me X, Y, and Z, I'm running and just like,
Checking
oh, nurse,
it out. Definitely.
come check this patient. I'm like, all right, this patient is good. Nurse, come do this. I'm like, okay, no problem. So I highly recommend respect your CNAs, love your CNAs as much as possible, because at the end of the day, if you have to do X, Y, and Z, and it's something that's reasonable, like for example, your vital signs. If you're a nurse and you have to do your vital signs for your patient, but that's something that could easily be delegated to a CNA, and that could help you in the process of doing your medication and your treatments on your patients. Let me tell you, as long as you like that CNAs or those CNAs know that you respected them from the get-go, and you say, oh, can you help me with X, Y, and Z? They're going to do it. They are going to do it 100% guaranteed.
Yeah. Awesome. That's a really good advice for all nurses.
I think you guys may have touched on this. Were you squeamish prior to nursing, and how did you adapt to seeing the nasty stuff? I saw it in clinicals. Whatever I saw in clinicals, I just kind of was like, okay, whatever, I saw this. Like, or whatever stories were based, I've heard from like my med surge professor. I loved her. So she would always tell us about her experience or things that she saw in the hospital as a nurse. And then she would just, you know, tell us about the story. So for example, my first patient, I remember one time she told us about oral feces. I didn't even believe that was a thing. But let me tell you, the first time that I saw oral feces, the first thing that came to my mind was like, oh shit, this professor told me about this. Like, damn, I can't believe I'm actually seeing it in real life. Or certain things, you're just like, maintain your poker face. Like, you're going to think this like, ew, but you got to maintain a poker face. Like, I am queen of, I can maintain a straight face, especially with COVID and this whole mask thing. Make whatever face you want under the mask. Ain't nobody going to see it. But without a mask, I could maintain a straight face. I'll just look at you like this the whole time.
Yeah.
What is oral feces? Oh, Joanne.
Google it. Google it.
It's oral. Let me try to pick. It's disgusting. Oral feces is basically when a patient is vomiting, but however, it's all feces that's coming back up.
So it can't go out.
It can't.
So it has to come out.
It has to come out, so it ends up coming out orally. Let me tell you, not the most pleasant sight that you would want to see, or smell. Trust me, even with a mask on, it's just kind of like, but you can't even like move. You can't even make your face. You can't even shake your head. You just gotta like, all right, let me just get through this room so I can get out this room. So that's about it.
Yeah, I agree with you. I think time will help you adapt, and as well as just knowing like, okay, this is someone's mother, this is someone's father, grandparent, whatever. If it was my loved one, how do you want them to be treated, and how do you want them to, even though they don't want to do it, or even though you don't want to do it, how would you want them to be taken care of? And you just do it. Yesterday I had a patient. She had her feet. It was her feet. Her feet were dry, scaly, and very swollen, but the flakes, it's the flakes for me. The flakes, it was flaking everywhere.
Those are the type, when you go home, you're just like this in the shower, like, all right, let me scrub.
Can you put my socks for me? I'm like, and I'm not gonna lie, I kind of hesitated, but I went back in there and I did it. I double gloved, but I did it. You see, like, just sometimes you gotta suck it up. You don't want to do it, but you're gonna do it. It is what it is.
It is a lot. You're going to see some crazy things in the nursing field. You're going to have physicians come in. And the physicians know damn well they don't want to do it, or they don't want to touch it their damn selves, but they're just going to be like, oh, do X, Y, and Z, and they'll just stand there. And you can tell that they're making a face. They're just like, and they're just watching us like, And then we'll walk in there and be like, damn, that was intense, wasn't it? And I'm just looking at them like, no shit, it was intense. I did the work. No
Yeah.
shit.
Yeah. Yeah. I've had that.
I don't know if y'all touched on this, but do you have a preferred nursing setting?
Go ahead first.
Well, I'm still at my first job.
Okay.
The rehab
is that where you want to? But that's not where you want to stay
No,
forever.
No, it is not. I am gaining as much experience as I can. I am rotating all shifts. I'm open to it right now, just so I can gain the experience and be comfortable in saying if I apply to another job that I can comfortably say that I have the experience, I have the background for X, Y, and Z.
Yeah.
So,
yeah.
But do I?
And I feel like once you do get to the next stage, I can't tell you how many people I know struggled finding jobs. And possibly, I don't know if it is or it's not, but because of my LPN experience, because I worked at a SNF, a rehab, I feel like a lot of people look at me and they're like, oh, yes, I want you. Like, you know what I mean? Because you have that experience and you're ready.
When you have experience on your resume, you're more marketable. You
yes.
are way more marketable. Like, you could have so let's say side by side, you have an LPN who went through her LPN, did her RN, did her BSN. She has all of these experiences on her resume. Then you have a fresh grad BSN that's just coming out, and you're weighing both resumes. Like, okay, this person has all of these experiences with this patient. This is a new grad. Which one are you gonna really take more chances with? Let me tell you. As a new grad, we're coming out of school and we think we know it all until you get on the floor and life humbles you. Like, oh, aren't you supposed to do X, Y, and Z? Life humbles you once you get on the floor. Like, you think that, oh, this is the correct way and this is da da da.
If you don't know, you'll find out.
You'll find out once you get on the floor.
Yeah, you'll find out.
Don't be scared away. Don't be scared away by all of this.
My preferred nursing setting right now, hospitals. I like hospitals. I like rehab. I'm gonna go back to the rehab probably, just to do it like part-time or PRN. I do like the hospital a lot just because I feel like you have a little bit more of hands-on and they're a little bit more organized. Rehab is kind of spontaneous, spur of the moment. What else? But I want to do management and I want to teach. That's my end goal. I want to teach. I like to teach. That's what I want to do.
So you want to become a nurse educator long term?
Yes, that's why I want to get as much experience as I can, every type of thing, and teach.
Do you have a specific specialty, med surg, psych?
I was thinking probably fundamentals, the easy stuff. But that's the base. If you don't got a good base, a good foundation.
But you know what? You know what it is? Like, for example, fundamentals is the first class that we take, and everyone sees fundamentals as being so easy, and then they'll do med surg, that's so hard, and then pharmacology, that's so hard, maternal, pediatric. You'll think that all of these classes are so hard. So when you're taking your NCLEX, when you're studying for your NCLEX, you're just like zoned in, like, let me study the med surg, and let me study this, and let me study maternal and pediatric. And then guess what? When I took my NCLEX, I was looking at these questions. Guess what? Fundamentals. I studied med surg. I studied
Me too.
Psychiatric. I studied all these things. Now, let me tell you, it was all going back to day one of nursing school. Fundamentals. Remember the basics. Learn the basics. That's all you need to know.
Those never change.
It's
the techniques or medications, whatever, can change. The fundamentals are fundamentals.
The fundamentals are pretty basics. It's all about infection control. It's all about what can you tell your CNA to do it or not to do. Like, I'm not gonna lie, my NCLEX experience, the whole time I was doing NCLEX,
delegating,
like, what the fuck is this? I was just like, what the fuck is this? And it's to like all of what can you delegate to your CNA? I'm just like,
yeah.
You mean to tell me? I studied my ass off. I studied a lot of medications. Like, pharmacology was my favorite hands down subject.
Yeah, I'm not.
Hands down pharmacology. You can throw anything pharmacology medication to me. I'll give it to you generic. I'll give it to you trade name, whatever you want medication wise. I'll give it to you. You need to get a tutor in pharmacology. I'm more than willing. Maybe future down the road, I'll be willing to tutor in pharmacology. But anything else, however, med surg, I'll just look at you like, what is this? Like, really, what is this? second. Let's add her back. Give me a second to add her back. Sorry, guys. The connection went. Oh. Hi, Joanne. In the meantime, does anyone have any questions? No problem. Let me cancel this. In the meantime, do we have any questions? Hey, sis.
Sorry, guys. I had 17%. I had like 20-something%. I thought it would last, but I guess it didn't.
All right. So at this point of the live, let's answer some questions. You guys can submit your questions, and we'll answer to the best that we can.
No problem.
All right. Let's see. Let me see. Move on to the computer to see better. I know Joanne asks, what is oral feces? I'm not going to give a live visual of that again. Right, Joanne?
I see a question here. Did you already answer it? I'm not sure. Were you guys strong in math and science prior to your prospective nursing programs?
I loved math. I loved math, hands down, math. So dosage calculations and for nursing, hands down, I was able to get anything. The drip factors, I loved it. I loved it all. So math goes hand in hand with how much medication are you supposed to give a patient, etc. So I loved it. What about you?
So in my nursing journey, I had the opposite. So in my LPN class, I failed because of pharmacology. So I took it. I took nursing school, LPN school with my two sisters. They were younger than me, and so we got to the med-surg pharmacology, and I failed. I was too lazy, and I didn't really want to put in the work. And so I ended up taking it again and passing it and killing it. Now I love nursing math, but that's it. I don't care about any other math other than nursing math. Pharmacology, I love pharmacology just because I know my meds, and I love learning about the different types of meds, but it's pretty easy. So don't be like me. Learn your math the first time around. And nursing math is common sense. Once you keep doing it, you'll see like, oh, it's just common sense, and it's easy. It's really simple.
Bell Corpa asks, how long have you been a nurse?
Me or you? You can go first.
Go you.
Oh, so I have been, sorry, I'm trying to charge my sister's phone so it doesn't die like mine. So, okay. So I have been a nurse for 4 years total. I was a LPN for 3 years. I've done everything. I've done assisted living, independent, it's the same thing. Assisted living, home health, rehab. I did rehab for 2 years. And then I did home health for like a year during nursing school. I did assisted living with a new built assisted living. And then now I'm working in the hospital as an RN. So that's 1 year experience in December. So I've done it all. I'm trying to get my hands in everything before I start teaching, before I burn out.
It says, how did you guys overcome the fear while working as a new nurse?
There's fear every day. I still get nervous. I still get a little anxious on new situations or like critical situations, but I guess it's a good nervous.
I walk into my shifts with some, if you're a Bible person, I walk into my shift with from 121. I'll say, watch me as I leave my house, watch me as I return. I'll always say, Lord, let this be a peaceful shift. That's all you could do. Let it be.
I speak over my shift too. Yes, I believe in it, and I tell everyone, like, guys, we're gonna have an amazing night.
You want a peaceful shift? Speak on it. Say this is
speak on it
out
loud.
A calm shift. It's gonna be no one's gonna die. Everyone's gonna be alive while I'm on my shift. And believe it or not, I say on my shift, and then somebody will call me and say, "Oh, you going so fast." I'm just like, well, was it my shift? It wasn't my shift. So
yeah. So you definitely have to speak on it. Speak it out loud, and it'll happen.
What would cause someone to have oral feces? Like, what condition would they be suffering from?
A bowel obstruction. Google is your best friend right now.
Well, in my case, I saw a oral feces due to in the middle of CPR.
Oh, okay.
So for that, I knew that, like, just by looking at the patient, I knew, like, she was gone. I was able to tell that she was gone, but, you know, as a nurse, we're out of our scope of practice to call it. Like, you know how, like, you know, they tell you when their bladder, if their sphincter relaxes, and then, so for her sphincter relaxes, she urinated. She also defecated on herself. But as we're doing CPR, like, and we're pumping her, it's whatever was left over is coming back up. It was just coming back up profusely. So we had to move her to the, like, put her on her side to suction her mouth. As we're suctioning her mouth, and I'm holding her to the side, and I'm just looking at her back, and I'm just like, in my head, I'm just like, I'm looking at her, and my first thought is,
I mean, I've had that as well. Now that I remember it, after you said that, I had a DNR as well, a do not resuscitate, and my first death. That patient had pancreatitis cancer, and if I remember correctly. And so during the whole crisis situations, because when a patient is a DNR and they're close to death, you call hospice and they'll do a crisis care. And so while hospice was on their way to bring the patient to a critical care unit in a hospital, that patient ended up vomiting and then, you know, passing out by the, you know,
oral feces.
So, so yeah, it does happen like that as well.
Yeah. Do you have any tips for taking the NCLEX?
I do. I have a video on that as well. Nurse Kathiana on YouTube. I have a lot of tips. Repetition. NurseJazztalks on YouTube. Is it just registered nurse? I think it's just registered nurse on YouTube. She has brown hair. She's white. She's country.
That's Sarah, right?
Yeah. But her name on YouTube is registered nurse. She's awesome. She saves everyone. Picmonic is really good. Saunders is really, really good. If you're going for NCLEX for RN, UWorld is really good as well. I didn't use UWorld for LPN, but I did use it for RN. So I used both. Saunders is really good as well. What did you use for your NCLEX to study?
So the truth behind my NCLEX studying is, I don't think I did study because due to COVID, I was able to land a job that was hiring. Like once you was finished and you was able to show your transcript, even though you were waiting to take your NCLEX, they hired me on the spot. So I would start working. So as I was working, I would just
learned on the floor
as I was working. So by the time I actually did schedule my NCLEX, I honestly I didn't even study. I think the morning of, I did probably a few questions on UWorld, and I went with God that morning. I just got up.
Ooh, you're brave. I couldn't do that.
I went to take my NCLEX. It shut off on me at 60 questions, and then I
think I had, I had like 130, 120, something like that. Right after I prayed to God, and I'm like, God, you're not about to let me get to like 200 and whatever the maximum is. I think it was 205 or something like that. Once I said that, it turned off the next question. I was like, okay, thank you. I'm done.
Listen, I saw 60 questions. I was like, what? I was just like, what? Yeah. So I'm walking out and I'm calling everybody like, it shut off on me at 60. Everybody's like, oh, you passed, Jazz. I'm like, no, I'm Googling. It says you could either fail or you could either pass. Which one is it? Everybody's
Yeah.
like, oh, you passed. Everybody's having fun.
No,
Everybody's
I know I
celebrating.
passed.
I'm just like, no, I'm just like, let's wait the 2 days. 2 days later, I went out and I saw it, and my heart just started going, and I was just like, okay, I passed. Whatever.
Yeah.
Kafiana, what about your childhood relates to your dream of becoming a nurse? Question from Bel Compa.
Nothing. I became a nurse because my mother forced me and my two sisters, the same two sisters that passed me in LPN. Those sisters, all three of us were forced. My mom's an LPN, and she was like, all right, you guys don't know what you want to do? You're going to be a LPN. And so we all did it, and we liked it. They do pediatric specialty, and I loved older people, geriatrics. And so my love just came from, I think, once I had failed my pharmacology, I think that's where my passion for nursing really grew. And I'm like, I want this. I need to complete it. I need to finish it. And that patient care, because I always worked with older people. So like I've worked at retirement home. I've worked personally one-to-one with a older woman. I was just her companion. We'd watch movies, we'd eat, we just chill. And so I've always loved to work with people. And at first I wanted to be a psychologist, and that didn't work out because I didn't know what the hell I wanted to do. But, you know, I've always wanted to work with people, and I feel like why not do nursing when you save lives in real time? And you're working with older people, you form relationships, you form bonds, and it's rewarding.
Indeed.
And you know, Haitian people, everyone want to be a damn nurse. They think nurses are so rich.
Last year, I said last year. I said last week, I told them the same thing. I said, listen, there's so much that Haitian people tell you have as options. They tell you you're going to be a doctor, you're going to be a nurse, you're going to be a lawyer, you're going to be an engineer.
Mm-hmm. If it ain't that,
those are the only options that you have. So It's up to you at that point. Nursing. So here we are. Haitian nursing at that.
The good questions.
Last question. Have you guys been part of my births during COVID? Any births during COVID?
Go ahead.
No, I haven't.
You haven't?
No.
I have not. Have I? No. Everyone's getting pregnant now. We're having COVID babies now. So, no, I haven't. I do know of a baby that was on the COVID unit, though. A 3-year-old. A 3-month-old. But typically, any babies that we get in our hospitals are traumas. So that baby probably came in because of a motor vehicle accident and then had COVID. They sent them to COVID type of thing. But no, personally, no. I don't know anyone. My best friend's pregnant. My god baby. But that's not till January. So, yeah. No, not really.
COVID baby. So, we have a minute left of live. I want to say thank you so much for coming out to NurseJazztalks.
Thank you for having me.
Guest. It was amazing. It was
my first live.
It was easier this week for me to be able to talk and be comfortable because I had someone with me.
You did amazing.
I look forward to actually meeting you when I'm out in Florida one of these days. It was amazing.
Yes, turn up, drinks on me.
And the brand will always be Manifesting Therapeutically. If you need a shirt made, at Lojo's Place on Instagram. Thank you.
Thank you, everyone. Thank you for watching. Follow me on YouTube at Nurse Kafiana. I have so many videos, over 100 and something.
All right. Thank you so much, guys, for tuning in.
Thank you. Thank you. Thank you.
Bye, Nurse Kafiana.
Bye, guys.